Welcome back to Prime Morning. If you just tuned in, good morning to you and thank you for joining us right here on Prime Morning. We are running through to 10 a.m. and it's time for Good Living segments. You know that every single Tuesday, that's what we bring your way. We bring you up close to all the things you need to know about your health. But since it is Ghana month, we are celebrating everything Ghanaian, everything traditional, everything cultural. And so we started a conversation on Good Living last week in relation to traditional aid, and our experts were here and they said the very important things that you need to know. Just to refresh your memory a little bit, some of the things that were shared, that when you have headache, please and please don't be quick to go and take painkillers. Don't be quick to go and take painkiller, okay? When you have a headache, do not be quick to take a painkiller. Not just that. If you know, let's say you have a tummy upset, we have a very interesting way of saying, oh, my stomach is paining me. It is because we have just generalized it and we are not too abreast with the fact that, okay, it is not your stomach per se, but it could be your upper or your lower abdomen. But do you remember that? Yes, and not just that, but we also cited an example where in case somebody is on fire, all right, somebody is burning up, please and please do not let the person run around or walk around with their hopes that the air would blow out or calm down the fire. It wouldn't. Let a person lie down and possibly roll on the floor. And we also learned that if there's an emergency where, let's say, there's a poison, a snake bite or something, please and please, the first thing you have to do is to lie on your left-hand side, because when you do so, it slows down the process of the poison, getting up and doing whatever and then causing any fatalities. I hope that I have refreshed your memory enough. There were so many other things that were shared. And one other thing too is that in case of burns, let's say in the kitchen, the first thing you need to do is to put water. Yes, water is the first thing that you need to put. I even cited an example that some years ago, I had an accident where our house help accidentally poured hot water on my chest. It was an accident. And the first thing that I did was to rub my hand on my chest. And unfortunately, it got deeper. And my uncle, who is a doctor, recommended, after my parents contacted him, he recommended that tomatoes be cut and placed on the burns. And it really helped. And Doc here mentioned that, yes, indeed, it does help. And so the first thing that you need to do, in case you have any burns in the kitchen, go and put water on the affected area. Today, we are going to talk about a part 2 of that conversation, and we're going to see how potent traditional first aid is. If you had any questions in relation to last week and you couldn't ask because maybe you joined later, this is the right opportunity for you to send them in. Earlier, I was saying that, do you have any myths or many misconceptions or any confusions in relation to traditional aid? Do you have any questions from last week's segment or last week's episode? Please, our experts are here and they're going to delve deeper into that conversation for us. Last week, she was here with us. Previous week, she has been here with us, and it's always exciting seeing her beautiful face and also hearing how calm and collected she puts out her submission. I am talking about Dr. Mavis Boakye Yadom, Head of Clinical Research Department, Center for Plant Medicine Research. Good morning. Good to see you again.
Good to see you too.
Last week was superb. I enjoyed myself a lot last week. So I know that this week, today is going to be no exception of that as well. And then seated to her right, I have Dr. Emmanuel Opoku-Aye, clinician, Clinical Research Department. Okay. Can you please help me with the CPMR? What is that?
The short form of Center for Plant Medicine Research.
Oh, okay. So it's a short form. Okay, all right. But good morning to you. Good to have you here.
Thank you very much.
How are you?
I'm doing well.
Did I do well with the recap?
Very well.
I did very well. Oh, thank you.
That means you really followed it.
Thank you. I paid attention because, some of the things, a whole lot of the things that we discuss are very important to me. And they are quite practical. They are things that do happen. And so, viewers, it's time for you to get your notebooks and start penning things down. Start sending your questions. Our WhatsApp number is very active. So please send your questions to our WhatsApp number. You can go to our Facebook page and get into the comment section. And when you get on Facebook, don't forget that you hit the share button. Now let's get right into our conversation. Traditional first aid. Last week, we established quite a lot. So this week, we want to talk about the potency of traditional first aid. So when we say potency on the whole, let's start off with that first. Then we can come one after the other. Yeah. Dr. Mavis, you want to start?
So when we talk about potency, we are looking at, is the thing working at all?
Okay.
So whatever you're given, be it medication that you want to use it to treat something, does it really get the effect that you expect?
Okay.
So we are looking at the effect you expect to see when you give that thing. Right. So that is what we are looking at today.
Okay.
Yeah.
Okay. So let's start off with the very first thing that was mentioned last week, and that is in case of an emergency. I even cited an example that when you go and you meet an accident scene and there are people that are injured, is it right for you to put them on the left, roll them onto the left-hand side? And you did mention that yes, you should do that and not just leave them lying on their backs and then all that. So let's delve deeper into the effect of rolling an individual or a victim who is possibly suffering on the left-hand side.
So basically, when you're turning that person onto the left, what you're trying to do is that you're trying to make sure that the person doesn't have a blocked airway. And then you lift the head a little up also, so that you open the airway enough so that the person doesn't get choked. So you put the person on the left, one for the digestive system to open up, and then for the airway to also open up.
So you lift the head as well?
Yes, you lift it a little bit higher. Yes. So basically, I keep telling people, especially those who snore in the night, mostly it happens with people with short necks, because if your pillow is very short, it doesn't help the airway to open up a bit. So you need a little higher pillow so that it can open your airway. So it's virtually the same way that we are talking about in the accident scene, so that the person that doesn't get choked.
Right.
You open the airway better, and then the digestive system also works better. So basically, that's what we're trying to do.
Okay.
Keep the person safe.
Keep the person safe. Okay. So in a situation where there's blood gushing out, there's a cut or one leg is somewhere, part of the leg is somewhere, then all that. Does that stop the blood flowing in any way if you have to turn them to the left side?
So basically, turning them on your left side actually improves circulation to the other part. But in a moment where there is blood gushing out, in fact, in terms of first aid, what we do is to stop the blood. So in order not to, lose more blood, the main point that we do is to stop the blood. If there's anything we can tie at that place of the injury, we tie. Then the main point is to stop the blood so that you can keep the person alive.
Yeah.
Then you call for help. Then you do the necessary arrangement for them to see the medical practitioners as soon as possible. So basically, if there's bleeding, even at home, everywhere we find ourselves, the first point is to stop the bleeding. In fact, that is where you've clean with the normal water. Some even recommend that we use normal mild soap with lukewarm water.
Yeah.
You clean the surface clean. Then you tie the place of injury to stop the blood from, the person from losing more blood, which can be detrimental. So basically that. So in the accident scene, most of the time, because we are not too informed about what to do, we are not inclined.
Yeah.
So what we do is just the positioning, then you call for help. as soon as possible, because those are emergency cases.
Yes.
Emergency cases, we don't have much knowledge about them.
Yeah.
So what you do, calm the person down in a very right position, then you call for help as soon as possible, then that can be solved.
Let's go back to the kitchen part. There are some people who, even after having a cut or a burn, they use salt. What exactly does the salt do?
So if it's a cut, then you don't need salt.
Okay.
The first thing you do, if it's a cut, is to wash with water first. And then in the kitchen, there are like something like cassava. Because we are herbalists, I'll mention there as botanical name. It is Manihot utilissima. Cassava, Manihot utilissima.
Okay.
So you can just peel off the cassava we use in cooking for
food. Yeah.
So you just peel it off. If it was on the farm, usually they would chew it and then put it on to stop the bleeding. But then, because if you're in the kitchen, you still have your knife, so you can just scrape a bit of it, the white part, and then you put it on it, and it will stop bleeding.
Wow.
Yeah. On the farm too, there's another plant that you could use if you have a cut. That one is called Hoslundia opposita, and Hoslundia is a champon. I believe when we were growing up, we saw it a lot around. Currently, I don't see much, but when you get to places that there are a lot of weeds, you can easily identify it, and that too can also help. Usually, you just macerate it, and then you put it on the cut or in the wound, and then it stops bleeding. So basically, what you do is you want to stop bleeding. You don't want the person to continue bleeding. First things first. Safety first.
Safety first.
Yeah.
You know, movies, especially foreign movies, has an effect on us. We trying to learn things and trying to adapt to things and all that, because we assume that the whites know better than we do. Now, when you watch movies and there's a snake bite or there's a cut, you see them pouring alcohol. What does it do?
Okay.
So basically, alcohol is acting as a disinfectant.
Okay.
So as soon as there is a cut or there is any opening at part of any part of the body, in fact, what we try to do is to disinfect any organism there, to make sure the wound is as sterile as possible, to prevent infection and all that. So alcohol basically is acting as an infection disinfectant to prevent any infection around that area. So normally they'll pour there, then you realize that they will tie.
Yes, they tie right
so
afterwards.
You disinfect, then you cover the wound in order to prevent any other infection that might affect.
Incredible.
But the alcohol too can let the person overbleed. So that's why you have to tie the place. So if you don't tie it and you leave it open, the person is going to continue bleeding. So always it's good that after you disinfect the place, then you have to tie up the place and make sure that whatever you're using to tie is clean. That's another thing.
Because they usually use dirty cloth.
Yeah, because if it's not clean, you are still introducing another thing in the
infection.
Yeah. So some of these things we have to be very careful what we use, but then at the spur of the time, the spur of the moment, we can do certain things that are not right. That's why we have to be very careful what we do.
Yes.
If it's water, fine. You are using just water to clean it, fine. But if it's alcohol and you are trying to disinfect, don't use it too much, because that can also open up the pores for it to bleed the more.
Can you give us some more insights on what other things we can use in disinfecting wounds in such situations?
That brings in the issue of salt.
Okay.
In the beginning you were saying, people apply salt and all that. Yeah. What salt also does is the same disinfecting.
Okay.
But that sometimes, because of the pain that, it comes, it has another property of chelating or collating or stopping the blood. That's the layman. So the bleeding that is coming when you apply the salt, it has the ability to solidify the blood so that it prevents the...
So you just prepare like a salt solution?
Saline.
Yeah. Normally they just apply the salt right away.
Okay.
Yeah.
It's actually better when you use the solution instead, because because if it's already diluted and then you're just washing it off, it's better than leaving it on. Yeah.
Oh, so it's better for you to do the solution.
Yeah.
Okay.
So the most important thing is to keep it as sterile as possible. So once you apply, then you apply any form of pressure, then the blood will cease. Then you move on to seek for further treatment from the personnel that are trained in that direction. So that is very important. Anytime, any type of bleeding, anytime you see blood, the first point is to disinfect the place.
Okay.
Then tie to prevent the bleeding.
Okay.
Then you can move on to the next line of action, which is seeing the professionals that are trained for that.
Okay. But the right thing to go to is to prepare the salt solution. So you add water to it and then, and apply it. And now for people in the rural areas, oftentimes when you hear that somebody has said, oh, I want a car, and all of that, I want us to delve a little more into that right now. So what are some of the things that you would have to do? I mean, last week we did mention that, the whole moving the person to the left side and then trying to reduce the speed with which the poison would be moving. And then tying, right? So what other thing do you do? Very necessary. So what other thing do you do?
So basically, when you tie, you finished what you need to do, call for help, so that whatever has to be done needs to be done at the hospital and not at the site where you save the person.
So in a situation where a medic is delaying in arriving there, what can you do?
The next thing is for you to look for any plant that could help. But if you don't find any, there's nothing else you can do.
Jeez.
You see, in the traditional medicine area, we call something black stone. But that one is made from bone. Mostly they use cow bone.
Okay.
Sometimes people say that when you put that on, it's able to suck some of the poison from the place. But how many people would even have the black stone at the spur of the moment?
Yeah.
It would be very difficult getting it. But sometimes if you are able to get that, maybe it could help for a while, but it's not something that you rely on. So you wouldn't say that because you have a black stone, you can just use it and that's the end. You still need to send the person to the hospital. Even though it might suck some of the poison, it might not suck everything. Because research has proven that the black stone actually sucks some of the poison. That is, if you put it on the bite area. But then there are even another research that people try to make it into powder and then put it on the cuts. But then they realized that didn't work. But in itself, when you put it on, it's able to pull out some of the poison from the place. So if you have a black stone, fine, you can do that. But if you don't have it and you have tied the area, that's the best you can do for the person, and then you call and wait for help.
Last week, we established the fact that the moment somebody feels tired, or is like, oh, your head is aching, and then you can easily mistake that for the fact that your head is aching you for actual headache, but maybe you're just tired or you're just hungry or sleepy or something. So all you have to do is to probably just rest. Yeah. Let's talk about headaches. In the first instance, if you have headaches, you did mention that drink water and then probably just sleep because you might never know. But what other thing can you do?
So, like I also mentioned that your blood pressure might be high.
Yes.
If you have a headache. So if your blood pressure is high, maybe you have stressed out, that you can rest as well. The next thing is, what kind of food are you eating? If your food is very salty, you have to stop it. It will not help you. If that's another thing. If you have fatty food, that's also another thing that wouldn't help you. So the first thing, your blood pressure is high, calm down, sit at a corner, try to see if you can relax, just relax. With time, we would see what exactly we could do to help you. But then if you realize that the blood pressure is high, and that's the reason why you have a headache, then you may have to go for further testing, and then we know what actually is causing the pressure to go high, aside the stress and other things that we know, and then we could give you medications to help you as well.
In what? Okay.
So actually, in terms of any pain is the body's own signal of telling you that something is wrong.
Yeah.
So when we look at headache too is part of the signal that is telling you that something is wrong somewhere, which we need to find out what is wrong.
Yeah.
So normally for headache, I basically so in terms of that, as my boss said, we need to look out for what exactly is happening, what is causing that pain.
Yeah.
Then we can solve it from there. But basically, in our terrain, especially in this part of our world, we realize that most of them are the things that enter into our tummy. So God being so good, because of the nature of our terrain, He has also surrounded us with so many things, especially the plants. Even some of them, we use them in our kitchens and all that, which can also help, especially for the interim. In fact, for the first aid, what we are seeking to do is that we are alleviating the pain in the interim. But then when the pain has gone down, then you are relieved, you forward it to the next level, which is seeing the professionals to find out what exactly is there. So basically what we are trying to do in terms of first aid is to bring down the unpleasant sensation that you are having. So basically the things that we have around, you can use
like
them.
What?
A typical example is when it comes to our kitchen, what we use in our normal food, like ginger.
Ginger?
If you look at something, if you go into ginger, then its constituents, so many benefits. We have seen that it is anti-inflammatory.
Yes.
Most often, the pain that we feel are as a result of inflammation. In fact, pain is one of the cardinal signs of inflammation. Then we've seen that ginger can also help in that direction. Ginger itself is analgesic. By analgesic, we mean a painkiller.
Okay.
So the basic things that we find around us itself can help us, alleviate whatever that we are going through. Then later, in fact, normally we say in our adverts, or we say when we are promoting our medicines, that when the pain persists after 2 days, consult your doctor. And so you try these remedies, or you try your hands on what you have,
and it's not working.
Then it's not working first day, second day, then that means you have to seek medical attention.
So maximum, you should see some improvement after 2 days.
Yeah, after 2 days, As she said, normally normal stress.
Yeah.
So after 2 days, if it's normal stress, then that means the stress must come down.
Yeah.
If it doesn't, then that means there's something else.
It goes beyond just being
there's something else
stressed.
we must find out.
Yeah. Yeah.
So he mentioned ginger. I would want to add a bit about ginger.
Okay.
Ginger is actually good for arthritis, as in pains, joint pains. So people who have joint pains are asked to infuse ginger. When I say infuse, in hot water, you put ginger, you just chop it in hot water for a while, and then you drink it. And it helps to bring the pain, especially the joint pains, down. So that is one of the things that you could do. But when it comes to hypertension, for instance, we have Percocet, tetraptera. So if you use Percocet, I don't want to be using the scientific names because...
Oh, what did you say it is again?
Tetraptera. That is Percocet.
Okay.
So if you have that at home, you can also boil it and then you can be sipping it. That also helps to bring the blood pressure down.
You know, ginger, you said that it has to be in hot water.
Yes.
Quite a number of us enjoy the whole mixture with ginger and other herbs. It's being chilled. Does that reduce what ginger does in any way if you use cold water?
If you use cold water, it might not actually bring out all the constituents you need because there are lots of things in there. The best thing you can also do, you can chew it and then just swallow. Yes, because it has some oils. And sometimes when you say people should put it in hot water, they might overboil it. And when you overboil it, you lose those oils. So what you do is either you chew it, you put it in hot water. As soon as you just put it in for just 5 minutes, you just drink it. You don't need to let it keep boiling because when you overboil, you lose the oils in there.
Because, these are local drinks, right? They do their very best to infuse these local herbs and, in there. And at some point, some of them, you have to put them through fire. And when it's on fire afterwards, then you chill it just so that it becomes enjoyable. So after it has gone through the fire and the necessary things have come out of it and it's infused in the drink and everything, when you put it in the fridge to chill, does it change? Does it go away?
So that's what I said. If the person overboils during the time that is being boiled, then you lose some of your oils. But if the person doesn't, then you are going to get everything intact.
And then, since you are not aware of how they're boiling.
So that's most often when you are boiling, you're supposed to cover it.
Okay.
Because when you cover, then it doesn't go off quickly. You have most of the things retained in there.
Okay.
Yeah.
Oh, right.
It's just like how we prepare our soups. You realize that even in our homes or growing up, when somebody is sick, we normally prepare soups.
Yes.
What we add there is the normal ingredients. We boil them. By boiling, they are able to, break their bones inside there, release the chemical that are going to work.
Right.
So once you have them, then you freeze. Already, the chemical constituents that are going to work are there already. You're only preserving them by freezing. So it doesn't actually. So the most important thing is where she was coming from, the boiling. How long are you boiling? Those things has an effect.
Doc, do you know what I'm thinking about?
No.
The soup. The preparation of the soup. Because we add ginger, garlic, all these herbs, wentia and all that. But you use the mixture to boil the meat. And then not just boiling the meat. Afterwards, you use some to, act as the base for the soup and everything. And it will stay on fire. Even before you serve, you will heat it again. Does that mean that we are losing the necessary nutrients they could be given?
It might not be all the nutrients. Like I said, there are some oils, we call them volatile oils. They would go, but then you still have some
left. So at least there will be some little left for you to.
Yeah, so that's why I was very specific. There are some oils in there that you might not necessarily losing everything.
Okay, so don't worry, you can still continue cooking your soup,
but don't overcook it so you get everything.
Exactly. It looks like
in Ghana we overcook almost everything.
Yeah. If you listen to the dietitians and the cooks, you realize that they stir fry some of them, you just heat them. Then but for us, sometimes we overcook them, then we lose some of these nutrients that can help us.
So our benquines and our light soups and then all that. Hey, so then how do we prepare that? And our rare quine.
So it shouldn't be on fire for that long. Once your meat is tender, you can even steam your meat separately. Once it's tender,
you put it in.
Then one is simmer for a few minutes. You can, especially when you are going to keep for other use for the next day.
Yes.
Because you're going to reheat.
Yes.
So you need to factor in all that so that you don't lose the constituents of these various ingredients that we want to benefit from.
I think this is the point I say that when we are cooking, we shouldn't only look at the fact that we are going to enjoy and fill our bellies. We should look at the nutrients that we will be deriving from the meal. So like our docs here have mentioned, please, we should stop overcooking our meals. And more because maybe you want some canzo in there or something. Anyway, so you mentioned hypertension and you mentioned precursor. Okay, let's talk deeper into that.
So precursor has the antihypertensive effect. It helps to lower the blood pressure that you are taking, that you have. So basically, in a home, you can use precursor. You just boil it for a while and then you drink it.
Okay.
It helps lower your blood pressure. Aside that, there's another plant that we use. It's called Lepia multiflora. In the Center for Plant Medicine Research, we have it's in a tea form. So it's bagged as a tea bag. So you can just pour hot water on it and then you use it to also help you with your blood pressure. And that also helps relieve stress. So most often when we see people who work like you, knowing that mostly you have to rush to get here, it's really good that you can take your Lepia tea so that it will bring down your stress level and then it will help your blood pressure to also be at bay.
We got our Lepia tea though, so
thank you.
Thank you so much. Yes, Doc brought us some Lepia tea, so we are taking them. Thank you so much. With the precursor, with the mixtures that you've mentioned already, how often would you have to do it, especially if you know you're hypertensive? Do you have to do it like an everyday kind of thing?
Yes, so if you have to be taking that, then it should be an everyday thing. But as we keep saying, you cannot say that because you're taking that, you don't check the blood pressure to know whether it's going up or down. It might be that the precursor might help you, but it might not be the ultimate. So once you start taking the precursor, please check your blood pressure. If it's not lowering as you expect it to lower, then please go to the health center, let them check well. And if we have to add any other thing, we would, and then help you get a better effect that you expect.
I've been waiting for an opportunity like this to ask this question. Some weeks ago, I went home and my mother gave me some powder, and she said that it's avocado seed that she had taken to the mill. So we have an avocado tree in our house. And when we are done eating the avocados, she gathers the seeds and she takes them to the mill and dries them, and then, does the pounding herself sometimes, and then all that. She packaged some and said I should put it in my stews, in my soups. And some oh no, oh yeah, if I So I know she's watching this morning. Hi, Mama. Hi, Daddy. They're watching this morning. So help us really understand what the avocado seed does for the body.
So basically, in fact, one thing we are blessed with the plants, then even the food that are around us, is the general immune system that it gives us. So every plant or particular herb that you take, it has that ability generally. What we, especially the people trained in that direction, does is that their concentration and how we formulate them is how we use them to treat certain kind of diseases. Okay. But in general terms, or in the general usage of things, they are all for immune. In fact, that is why she said it will help you become stronger. So all the herbs that we use around, one cardinal thing is that it supports our immune system. Then again, talking about immune system supporting, then we will talk about quantity. Yeah. And that is where the professionals must come in. Yeah. So normally it's where we don't know how we are going to take them, even how to prepare them. But for yours, you said just put them in your...
Yeah, he said just a little, he said a teaspoon, for teaspoon, not take a crab enough for pity for you.
So you see, your mother is more than a herbalist.
I tell you.
Because they knew it. They knew it growing up. They knew it so that at least that little quantity that you've taken will only boost your immune system. Okay. But when it comes to specific disease conditions, that is where we come in. Then the dosage comes in. We know how much you're going to take to, treat certain diseases. So basically, just for, helping us for our immune system. In fact, that's why the soup came in. Then normally we say pepper soup. Yes. So that at least you recover from whatever you are suffering from. So just for immune system.
Okay. So talking about soups, I remember some time out of the country, and I think it was Americans, they kept saying chicken noodle soup. And I was like, chicken noodle soup? What is chicken noodle soup? And they're like, when they were sick, they had fevers, their grandparents used to prepare chicken noodle soup. And they chop chicken very small, like they chop it, and then add noodles. And then add spices, pepper, what we would call escherichia, piper guineense, and then all the other spices that we use here. And they give it to the person. When the person starts sweating, it means the fever is becoming better.
They just chop it up.
They chop it
and
up
heat it.
And mix it up. That's it. And that is the soup. And when you look at it, in fact, it is water that you see your face in it. And sometimes you're like, when you're from a part of the country, like even light soup is not this light. So basically, whatever we are eating is supposed to help us. On the avocado, avocado actually helps with cholesterol as well, the avocado seed. Okay. So people do it in teas as well. So like the mixture your mom gave you, you can mix it with hot water and be taking it. It also helps with cholesterol. Nice. So that is one thing. On that note, I would want to say this as well. Mostly when fruits are in season or whatever veggies are in season, it is good that you eat it at that time. Why? Because it means that is the time that the thing works for your body and it protects your immune system. So anytime there's something in season, you have fruits, especially watermelon, you have avocado, you have mangoes. Anytime these things are in season, those are the times that you really need to eat them because those are the times that your body needs it. The way God actually created us with the things around us, everything around us is supposed to help us keep our health. Okay. So every single thing that is in season, don't forget, eat it as much as you can so that whatever benefits you need to get from it, you also acquire it. at the time that it's in season.
What
Never
happens?
forget
What
that.
happens when it is out of season, but you still consume it?
So when you are consuming it out of season, you don't get the best effects out of it because it's particular for a certain season, and that at that time that's when you get the best of its effects or its benefits. So these are the things that we need to do and note very well.
Because one particular fruit or vegetable is avocado a fruit or is a vegetable?
It's a fruit.
It's a fruit. Thank you very much. So avocado, that we call, a lot of you call pear, but it's not pear. It's avocado. It's a fruit.
Yeah.
We get confused a lot with the season because you would think that, it comes between the beginning of the year, within the first quarter of the year, or, from November, December into the new year, and then it lasts for about 3 months and then it goes away. But then you will still find avocados on the markets in May, June, July. So with that, you're not supposed to buy then.
So once in a while, if you're taking it just for the delicacy,
once in a while, it's fine.
If it's just for the delicacy, fine. But when it's really in season, that is the time you need to really eat it.
Amazing. Viewers, I hope that you have learned a lot from this conversation. I've learned a lot as well. And we still have our guests here who are teaching us the potency of traditional first aid. And so are your questions coming in? Please, we would love to read your questions in relation to this topic. Now, with tummy upset. Last week we said quite a lot of things that you might never know. It might be your upper abdomen, lower abdomen. You don't know, but you say, my stomach is paining me, my stomach is paining me, but it might not be it. For the sake of those that were not able to watch from last week, let's recap on that in particular.
So basically, when you have an abdominal pain, the first thing you do, get warm water and drink. Because one, if there's indigestion, if you drink the warm water, it will help. If it's gas, warm water will still help. Whatever it is, the first thing, take warm water. If you take warm water and the pain doesn't go down, it might be something different. Go to the hospital. Let us assess what exactly the problem is and let us see to it. The other thing is that I mentioned last week that you could also use guava leaves. Leaves. Pseudium guajava, like we would say. So guava leaves, you boil it a bit, and then it's warm. You take that as well. That can also help with abdominal. But then water is easy to get. Warm water, get it.
Does it? Do these help with menstrual pains?
So for menstrual pain, even with warm water, yes, warm water helps with menstrual pain.
Okay.
But then because menstrual pain is actually associated with your uterus and the things that are happening in there, there are other things that would help you as well. So if you've realized, most people would use warm water bottle. They just put it on just to reduce the pain.
Very true.
But if you are drinking the warm water, rather, it helps more than just putting the hot water bottle in there.
Okay.
The other thing is the ginger as well. If you also put ginger in warm water, it helps with menstrual pains as well.
Speaking about warm water, how can you know that the water you've boiled or you've got is warm?
Okay, so if water is warm, you can easily put your finger in it. If it's too hot, you can't dip your finger in it. Because if you put your hand in it and it's just too warm, you cannot even drink it. It might even burn you.
Okay.
So the basic explanation you can give is if it's a tea temperature water, then of course then it's drinkable.
Okay.
But talking about the tummy pain, normally for our viewers' sake who might not be inclined medically, they are talking about our tummy and the intestine. That is the actual stomach and the intestine. That is where the first aid comes in.
Okay.
So when you try the ginger, as we talk about, then there is this common herb that we have in our kitchen. That's xylopia. They call it
Ventia, okay.
Yeah. So all that, these days we have blenders, the small part of the blender where, you can break things down into smaller pieces. Yeah, you can use it, break them down, just a teaspoon, then a normal teacup water of warm water. You can take that in the morning and in the evening. Okay. Once you do that, as we said earlier, you monitor for a day or two.
Yeah.
Because the target is you, for the layman, is your tummy where you eat, then the food goes, and your intestine where, our food digests. So when you take this and it doesn't subside, the pain doesn't come down, and that means it is something else.
Okay.
Any other portion of the abdomen where the pain is, except the tummy and the intestine, that is for the medical people to assess.
Okay.
But you in the house, because you know where you eat and the food is, that is where you are targeting.
Yeah.
So once you take these, what we are talking about, are normal, herbs around or are normal spices around, you put them in warm water, then you take either in the morning or in the evening. Then the pain doesn't go within 2 days. That means it's something else which you must proceed to the health sectors or the professionals to help you.
All right, so viewers, I know that you've learned a lot. I have learned a bunch. But Dr. May, briefly, before you go, your final submission out there on this topic, what would you tell viewers?
So we have mentioned a lot on what to use or whatever. I would end by saying, quoting the Bible, Ezekiel chapter 47, verse 12b. It says we should use the leaves to cure diseases. So God actually has given us everything in our environment for us to use to keep healthy. So go for those things, the food we are eating. And I'll say this again, let your food be your medicine and your medicine your food.
Oh, nice. Let your food be your medicine and your medicine be your food. Dr. Aye, final submission.
Everything we need that will help us has been given us around us. So, in fact, that is why it was a good idea that a setup like ours is there to investigate into these things. So normally, when we have opportunity like this, we call for help or we call for sponsors. So that there are so many things that we can get from what is around us. Unfortunately, in this part of our world, we don't normally get the funds, So we will plead that all that we need to help us as Ghanaians, since we are celebrating this Ghana month, we have them. What is left for us to go into it, investigate more, and that will call for more sponsorship. We need partnership at our center. If anybody is willing to collaborate with us, I believe we can even come out with potent medicines that even the West can even come then sort for them.
Okay.
So everything we need, we have them. Just that we need that collaboration so that we can bring them up to help us.
Thank you so much, Dr. Aye. Dr. Boakye Adam, thank you so much for your time. Viewers, thank you very much for your time. But before we go, Ghana Meteorological Agency, there's a warning out. It's a weather warning for Ghana. So please this is what it's saying, and I'm reading this, the summary. A moderate rainstorm located over the eastern coast is expected to affect the central and western portions of the coast, inducing cloudiness and producing slight to moderate thunderstorms with or without rain of varying intensities. And as I'm speaking to you, the warning out there, I think it has started. So please, these are the affected areas. There are areas to be affected. That is what you're seeing down there. Between the hours, between 9 a.m., so 9 a.m. to 10 a.m., we have Keta, Aflao, Akachi, Sege, Right, so these are the names of the towns to be affected. And around 9:30 a.m., we have Afienya, Ashaman, Accra, Akimoda, Koforidia, Medina, and its surroundings. That is between 9:45 to 11 a.m. 9:45, 10 a.m. to 1 p.m., we have Kaswa, Kokrobite, Cape Coast, Oblogo, Winneba, Salt Pond, Axim, Takrade, and its surroundings. So please, if you are watching us from any of these areas, please be on the lookout. Be very careful out there. Be very mindful. Those of you who maybe are listening to us on our Facebook, you've opened our Facebook, but you're not watching, but you're listening, and you're driving, please be careful whilst driving. And if you can get a safe place to be at for now, for the time being, please do so. All right, so that's it for Good Living segments. I know that you have learned a lot. Today has been very practical, and I have enjoyed myself so much. My name is Esiedua Akumia, and I have to let you know who my guests where Dr. Mavis Boachi-Yadom, who is the head of Clinical Research Department, Center for Plant Medicine, and our gentleman here is in the person of Dr. Emmanuel Opoku-Aye, clinician, Clinical Research Department. And so thank you so much. But viewers, we have some messages that we have to read for you. Okay, so good morning to you. This one is talking about the undersea cable disruptions. All right, so let's see what we have here in relation to our topic for discussion. I can see something about the avocado that we put there. So if you can kindly get that message. Okay, so let me do this one first. Good morning, madam. These are good, but how can we get them in all corners of the country? I suggest they use marketing strategy that will bring it closer to us. There are these young boys and girls who walk around selling Chinese medicines to us. Saka Mohammed was a Kropon. Okay, he corrected himself. He says they should adopt such strategies. Thank you so much for your message. Let's take the next one, please. What are some of the herbs that can aid weight loss? This weight loss matter is a whole topic on its own, viewers, because there are so many products out there that are saying that, oh, it is all natural herbs and they will aid you in weight loss. You go and buy them. So we have next one, remedy for ulcer, please. Good morning, please. What can I use for ulcer and bloating? Oh, viewers, how I wish that we could do this a little bit more, but we are pressed for time. We have to get into the entertainment segment for this morning. But my name is Esiadua Komia. Dr. Boachi-Yadom, thank you for your time. Dr. Aye, thank you so much for your time.